morning and welcome. It's my pleasure to introduce your speaker today, Akash Sridhar. He is a cybersecurity analyst specializing in incident response, email security, and defense strategies. He holds a master's in cybersecurity from the University of Houston and multiple industry certifications, has professional experience in healthcare security operations, threat detection, and security engineering. He also actively researches advanced threats to healthcare, focusing on practical mitigation and stronger defensive postures. Please welcome our speaker, Akash Sridhar.
Can you guys hear me? Can you guys hear me well? Perfect. Perfect. Thanks for coming to my talk. This is officially my second talk. I did the same topic in a different conference, but today we'll be talking about email security. You know, a lot of folks out there, they've been talking cool stuff. I mean, different new stuff, but we're going to talk about the same email security, but we're going to talk about email security in healthcare. So email security, you know, it's a broad topic. I mean, it's there for decades, and hackers are trying to approach with different techniques to get inside your network, but still email remains the #1 entry for hackers, and especially for healthcare, email is going to be the biggest issue. Today I'll be sharing about my experience, you know, what I faced in real time, you know, being a security analyst, working in like more than 2 years now, and it's about me. My name is, as she gave an intro, but let me give my small intro. My name is Akash Sridhar, and I do have pretty good experience in threat detection and incident response. And if you guys have seen vendors, right, the vendors hall, have really good experience in proof of concept, fancy tools out there, all the fancy tools you guys can name, have done the proof of concept. And I got my master's in cybersecurity from University of Houston, so it's good to be back to base. You know, Houston has always been my special place, and I'm happy that you guys are here for my talk. And I've published a few papers in cybersecurity too. Yep, it's all about me. So as I was talking before, healthcare email security. You know, I told you before, right? It still remains the #1 entry. The reason is people. Today we'll be talking about not just about email security. We're going to talk about risk and compliance. We're going to talk about third-party risk management, how vendor risk is affecting email security in healthcare, and we're going to have I'm going to share a lot of real-time experience with screenshots, the attacks which are happening in real time in healthcare, and I hope you guys enjoy it. And then we'll be talking about the basic security protocols, the email security protocols like DKIM, DMARC, and SPF. That's still not, I mean, it's there for decades, but still it's not implemented in healthcare properly, and how that's going to affect people and the company itself. So you guys can see here the human factor. So why healthcare employees are #1 target here? The reason is direct access to sensitive data. So if you guys can see in healthcare, it's not like other IT industries out there. You know, role-based access control, things are a little different in healthcare. People have access to direct PHI and PII information, and people in healthcare are not super techy, and it's easy to perform social engineering with them. And I've seen real-time threats, you know, people just give out whatever they get, if they get an email or a phishing call from someone, they're going to believe it's legit. They're not going to rethink, you know, if it's a right person calling them. And the second one, so this one has been, oh, sorry, I didn't go to the next slide. So the second one, work email abuse. So this one has been for a long time in healthcare. They use work email as their personal email, and it's been going for a long time. You know, people don't listen if we tell them do not use your work email for your personal stuff, but people still do, and this is still happening in healthcare. So how do we prevent this? You know, by giving proper cybersecurity awareness training. I mean, you know, you can send phishing simulations, phishing awareness, but most people in healthcare, it's really difficult to get their attention towards security. You know, I got really good experience. I mean, people just click whatever they see, and if you go and tell them do not click it, honestly, they don't care. And getting their attention towards security, it's really hard. The reason is, if you guys can see my third point, it's high pressure environment. Staff, they make like rapid decision under like stress when they perform surgeries. And in healthcare, it's like different thing happening all at once, right? We got appointments, we got surgery centers, we got physiotherapy, and people are really under stress when they deal with cybersecurity. And when you go and tell them, don't click this, you got to have MFA, that's the right thing you have to do. And they don't listen because all they want to do is just to complete their task of what they have in the current moment. And fourth one, so we're going to talk more about this today, trust in vendors and patients. So email that appears from known vendors, we as in healthcare, we work with a lot of vendors, we sign contracts, and the problem with healthcare is we don't assess their security posture. We're going to talk about this in a separate slide, but this has been a big issue because if healthcare works with other healthcare a lot. We got like collaboration with other doctors. We perform surgeries together, and we also work together in computers, right? We integrate things together, and when you do that, you have to assess their security posture, and we'll be talking about more about that later. And the fifth one, limited cybersecurity, awareness training. Even if you send, as I was telling before, send them multiple emails, it's difficult to catch attentions of healthcare employees. The audience in healthcare is a little different, and we'll be talking more about that. And AI-enhanced attacks. So nowadays, people generate really nice emails using ChatGPT, and we're going to talk deep about that too, but it's happening now, and when it happens, it's even as a security engineer, you working as a security professional, it's hard to determine if it's legit or if it's someone, bad guy trying to lure information. So, and business patient impact. As a healthcare, the reputation is really important. Without reputation, you don't make business out of healthcare. And I kind of felt in real time, if you don't have a proper name as in healthcare in a city, so I'm from Tennessee, Memphis, and we got like 14 branches across Memphis. So if someone says Campbell Clinic, everyone knows the clinic because it's because of the reputation and the doctors, how they work towards, the surgery and the service they provide. But cybersecurity, if they get a news headline that the clinic has been breached and your information is out, you lose reputation. And we'll be talking more about that too. So if you guys can see here, this is a random thing which happens all the day in my daily work life. Doctors and nurse and people working in different various departments, when they click emails, when you go and tell them, sorry guys, I'm changing slides here, I'm not changing it here, my bad. So when you go and tell them, do not do it, do not go and click, sometimes the response would be a little aggressive. And in IT, it's different. People understand things because they work in computers in day-to-day life. But in healthcare, it's not the same way. So to approach them and letting them know that, don't click it because it's not clickable, it's a little hard. You have to make sure that you tell them in a way they understand. And if you go and just tell them that don't click it, they're going to do it anyway. So because they don't care about cybersecurity. And it's really important for you to, approach it in the right way. A cost of a single compromise. So a cost of a single compromise in 2025 is almost 10.93 million based on IBM. And healthcare tops all the industries in breach due to PHI and PII information. I don't know if you guys know here, dark web. If you go to dark web and see the expensive data that gets breached and sold in dark web is healthcare data, because healthcare data contains everything, PHI, PII. They're going to know all about your body, right? And those data are expensive. And that's the reason hackers, they target healthcare a lot. And if you guys can see in other conferences in here, they don't let you guys know about healthcare a lot. They talk about different EDRs, ransomware. I know ransomware happens a lot in healthcare too. We're going to talk about that as well. But everything comes through email, and it comes through vendors, people you trust. Even they're not like super secure. They can get hacked as well. So it's really important to make sure that you have proper email gateway in your system. We're going to talk about that too. And 70% of ransomware starts with phishing. If you guys go and talk with other vendors, this 70%, if you go and say like 5 years or 10 years ago, they're going to believe it. But now they say that, attackers exfiltrate through different way. They got different methods to come in. But still in healthcare, it starts with phishing. And the downtime is going to be crazy, because the reason I'm talking about downtime, each day when you have downtime, you're going to lose a lot of money. And healthcare makes a lot of money in the US. So you guys know how much they make and how much we pay for healthcare. So having availability and uptime is really important. So make sure you got pretty good backup too. And I was talking about this before. Patient trust is really important. When you get into a breach and you get into a newspaper or an article saying that your healthcare is breached, you're going to lose reputation, you're going to lose money, you're going to get a lot of lawsuits. And the interesting part here is cyber insurance. So cyber insurance with healthcare, it's expensive. You know, you guys have to pay a lot of premiums just because you're healthcare, even though you guys have CrowdStrike as an ADR and Mimecast, Darktrace as your email. It doesn't matter, because the workforce in healthcare is going to be a little less. You know, if you take my company, I'm the only guy in security. I lead security operation for my company. We have around 1,000 employees. So it's so hard to, explain to the insurance company saying that we got really good security, we got amazing people, and it happens now. And I mean, insurance, when you work with CrowdStrike, they do give discounts, and things are a little complicated in healthcare. So these are the common threats that we face in day-to-day basis. And the first one is CAPTCHA verification attack. So this one happens through a CAPTCHA verification when you try to log into a website. So we as a healthcare, we use a lot of third-party websites to perform, operations like physiotherapy, learn, get notes, do courses. People use different type of websites that you don't even know. And you can't control that website security, right? Those are third-party websites. So you never know when it's going to get compromised. So a lot of things happens in real time in healthcare that I'm going to show a screenshot that I face in real time. You never know when it's going to get compromised, so that you got to be careful and make sure that you train employees, letting them know that do not run anything you see. If you see something suspicious, let the security team know. And second one, this has been for decades, QR code phishing. This is still there, guys, and people scan QR codes just because they are they're curious. I'm curious sometimes to scan QR code and see what's going on. But we as a security people, we scan it in Sandbox, but patients and doctors, they scan it in a phone and check what's going on, and they just give whatever, if a guy is trying to lure your credential through QR code, they're just gonna log in, and that happens. And third one is MFA bypass. This has been happening a lot. And fourth one is a crazy one. This is really old. DMARC, TKIM, and SPF. This is domain spoofing. If you don't have these basic security protocols implemented in your domain is going to get spoofed. So my story, recently, I was in Grand Canyon for my vacation, and one of my CFO, my company, his domain got compromised. The reason is, I'm gonna show a screenshot about it. I don't want to talk the whole story in one slide. We got a lot of time. I'm gonna share the reason. It's gonna be a funny reason. Just wait for it. And first one, excessive email whitelisting. I get a lot of requests from HRs, from doctors, whitelist this domain. This domain should not get blocked. If it gets blocked, you're going to get into a problem. Sometimes they threaten you to whitelist it, and it's going to be hard for you to let them know that these domains are not safe. But sometimes, if doctors ask you, you have to do it, because you have to accept the risk and do it and make sure you monitor them. How many people here have a vendor risk technology in your company? Do you guys monitor your vendors? Oh, nice. I see 2 people. I mean, it's so hard nowadays. When I tell my folks in healthcare, do you guys have a vendor security? I mean, do you guys monitor your vendors? They don't honestly care. I mean, because whatever vendor security you're going to have, they're going to scrap it from open source and show it to you in a dashboard. But that's also a really good information, because if your vendor gets compromised, it's going to come as a supply chain attack, and it's going to be a problem, right? So make sure you have a vendor security in place. We do have pretty good vendor security, because as I joined here, being a only guy in security, it's very hard to monitor vendors. But we should have some kind of visibility towards vendors. And when you sign contracts, I get a lot of questionnaires from them. What security do you have? Do you have EDS? Do you got email? You gotta fill all that questionnaires and send them, and so that they approve the contract. Make sure you do the same. When they ask about your security, you have to ask them back, both ways works the same. So I ask them a lot of questions, and nowadays I've been trying to filter out questions and send to all my vendors before anyone signing contracts. That is important. And human error and social engineering. This is so easy in healthcare, guys, because audience in healthcare are not super techy. You call them, you ask them anything, they're gonna just provide. But nowadays things are changing slowly. I know I've been trying to train my employees, telling them don't do it, don't do it. But yeah, it still happens. So vendor risk. This is I talked about this a lot now, but this is really important because the problem here you see is supply chain attack, weak security postures, and we got visibility gap. So these three things has to be covered a lot. If you guys can see that real life case study there, that happens in day-to-day basis. That doesn't happen like once a month or once in 6 months. We have seen attackers compromise a vendor email, and that vendor sends us invoice. We get a lot of invoice in day-to-day basis to sign contracts, and we get invoice about the service we provide. So a lot of things are managed by third party. MSP and MSSP, you guys have to be careful when these things happens and make sure you got your SIM, you integrate with your email, and you push the logs to monitor them. And HIPAA. So why compliance is not enough? People think that passing a HIPAA compliance audit is something that you guys are secured. So I'm saying that passing a HIPAA compliance audit doesn't mean you're secure. Compliance is great. I love compliance. Anyone loves compliance here, right? You got to be compliant to the government. And if you breach the HIPAA rules here, you're going to pay a lot of money. And managing HIPAA rule is really hard sometimes, but passing it is really easy. It's going to just, you're going to just implement few requirements that the HIPAA law says, and it's going to be easy. But passing a HIPAA audit does not mean you're secured. If you guys can see there, HIPAA fine starts from $100 and it goes up to $50,000. And the third one here we see is the AI shadow IT risk. I have noticed a lot of people trying to paraphrase their emails through ChatGPT. I mean, we do it here, right? How many people use your ChatGPT to paraphrase email? Come on, guys, be honest. Oh, yeah, okay. It's good to see no one is showing their hands, okay. But people in healthcare, they do, and when they do, they're going to upload sensitive information like patient data. ChatGPT is really good in paraphrasing email. I love like using ChatGPT, but you can use ChatGPT to do anything, but do not upload sensitive information. People do that here. They upload patient data, date of birth, social security numbers. These are like PII and PHI information. And by doing this, you're breaking HIPAA law. And when we try to block ChatGPT through deep packet inspection, people get mad, They're like, no, we don't live without ChatGPT. So they email me, shouting at me, saying that no, I use ChatGPT for this, for that. I mean, you should not use it. You can use it for your personal purpose. That's good, but why you upload your sensitive information like work stuff into ChatGPT? It still happens. I mean, you can prevent it by implementing a DLP solutions, but sometime, since I'm talking about healthcare, if you implement more security, the more and more security you implement in healthcare, they're gonna get mad. I don't want to use the word, but they're gonna really get mad. So it's not easy to add layers of security in healthcare. It is really not easy. Business protection. Oh, did I? Oh yeah, perfect. So this is something that I was already talking. So protecting patient trust. I have seen patients in my company saying that I have to meet this doctor. This doctor is great. He provides really good service. He helps me and he has done my surgery. It's all good. But that doesn't even involve cybersecurity, right? It involves physical interaction. But when real security threat happens and when you get a ransomware and you lose money, and everything gets locked up, and you get into a news, saying that this clinic or this hospital got breached. We have seen a lot of hospitals getting breached and getting ransomware. A lot of hospitals, they do let FBI know that we got breached, but a lot of people don't do that. The reason is reputation. Sometimes people have backups. They make sure that they get backed up when everything gets, messed up, but some people don't do that. And that's scary, right? You have to let FBI or someone know that you got breached so that they will come in and they'll help you and they'll make sure that it doesn't happen to anyone in the other industries, other industries in IT or healthcare. And preventing financial loss, business email compromise. We're going to talk about that too. This happens a lot with executives in healthcare, CEOs and CFOs, gift cards. How many people here get emails about gift cards here? We get every day, and people sometimes, I've seen one employee going to Kroger, getting a gift card, because the CEO was emailing her, asking her, get me a gift card, I'm going to give you a promotion today. that still happens, We have seen this like 10 years ago, 15 years ago, through stories and through movies, but in real time, it still happens. It doesn't happen in really big companies, big hospitals, and it happens in small cities with rural areas, having small clinics. It still happens, guys, because these guys are not yet updated about new technologies. And the last one is ensure community of care. Cyber attacks can delay surgeries. This happens when you perform a surgery, you get a ransomware and you get your mission logged, and your medical devices are not going to work anymore. And this is scary because this involves patient lives. It involves lives, right? With IT industry, it involves money, but in healthcare, it involves lives, and that's really important. And recently, I've seen healthcare have started investing, creating budgets for cybersecurity so that they don't get messed up. But before, 5 years or 10 years before, when I see healthcare, when I talk to my friends, they don't have really big security team, and still they don't have it. But now they're slowly moving towards seeing all the news out there. They are trying to spend money, making sure that they are secured all the time and they can run business every day. So this is the attack I was talking. This is happening all the time. You guys might have seen this happens to DocuSign. People get contracts and they got to sign it through something, right? DocuSign or Adobe. This still happens in all the company. I don't know if it happens in IT industry. IT industry, they got pretty internal red team, internal blue team. In healthcare, we don't have that. We don't even know what is internal red team or blue team. So when people get it from DocuSign, they just think that, oh, it's coming from DocuSign, it's going to be legit. They don't see the domain, they don't see anything, they don't see anything at all. They just open the document, log in with your credential, because it's going to prompt you a login page that a bad actor created through HTML. But it's going to be funny because they log in and they just give their information. They just pay whatever payment gateway they get. It happens a lot. And when this happens, the scary part is they don't let anyone know. They just think that they paid the vendor. And after some time, the vendor comes in and you got to renew your contract, bro. And they'll be like, we already paid it. So you're going to know it after like 4 or 6 months after it happened. And that is crazy. You got to be careful about that. So these are real life healthcare cyber attacks that I see in day-to-day life. The first one is Luma Stealer CAPTCHA phishing attack. When a vendor's website gets compromised and when you try to log in, get a CAPTCHA verification where it's going to show you a PowerShell script and it's going to tell you to copy that, paste it and run so that you can log in. This is so basic, right? Anyone is going to know that you're dumb. You're not going to run a PowerShell script to log in. But people do that. People do that a lot. But we can't blame them because they're not techie. But you got to let them know that this is not how login happens. You're not giving a PowerShell script to log in, because when this happens, it's going to connect to a C2 command server of a bad guy, and he's going to get in. Most of the time, firewall is going to block it. But sometimes, when we have a misconfiguration and when we did not configure firewall properly, it's going to still connect to the C2 command server, and the hacker is going to get in. He's going to deploy whatever he has, malware, ransomware, and everything. And the second one, I talked about this a lot, vendor compromise, supply chain attacks. You guys can see here, the wire routing number is this. Can you please make the payment? And this is not going to come from a random person. It's going to come from a person that account got compromised from a vendor. And the employee is going to think, oh, okay, it looks legit. I know her. So they're just going to go ahead and pay for the money. And this happens a lot, that healthcare lose a lot of money and they never know because they don't care sometimes. And after a while, the security teams comes in, you guys lost a lot of money, and they're going to then get mad and start creating budget for money. The funny part with healthcare is they lose money so that they can create budget to hire security people. That's funny, right? You gotta hire people to not lose money, because the healthcare keeps waiting to lose money, and they're like, nah, we are fine. We have not got ransomware in the last 60 years. And once they get it, they lose millions of dollars, and now they go and create, a budget hiring someone for like 60, 70K. You could have done it before. So yeah, it happens. These are some best practices you can see here. You got to limit vendor whitelisting. Do not whitelist whatever you see. I don't know, I didn't ask this question. Is anyone here working in healthcare? I should have asked it before. Oh, a lot of people. Oh, nice to see. In my previous conference, no one worked in healthcare. I felt alone. Thanks for coming, guys. You guys know my pain. So limit vendor listing and conditional MFA. This is really important, too. And I've seen a lot of my friends, they don't have an IR playbook, to perform, simulations of what's going on, and you need to collaborate with your help desk to do it. We got a lot of help desk in my company, and when something happens and when I'm sleeping or when I'm on vacation, they don't know what to do. They're like, what I'm gonna do? I got this. Some doctor's gonna call and he's gonna tell, oh, my computer is locked down. It's not opening. And you gotta tell them, you gotta give them a guide of telling them who to contact, escalating things, right? And if you guys have a big team, it's going to be different. But being in a small healthcare with a limited number of people, you need to have a proper guide which says where to escalate what and everything. So that's really important. So this is difference in depth in email. You guys can avoid that screenshot. I just made it to make it fancy, so it's not the difference layer. So this is something guys have to follow in healthcare. The first one is mail flow hardening. We got to enforce strict routing rules. No open direct send. I didn't talk about this. So there is a feature called direct send in Microsoft, where you can send emails directly to the person without, you can bypass everything, whatever is that between, because you're going to send it behalf of Microsoft. And when this direct send is turned on, hackers are going to use your domain, and they're going to send it with Microsoft. And it's going to bypass all your email layers, whatever email gateway you have. This one recently happened with us, and we had to, go and add the trusted IPs in connectors. Make sure you got trusted IPs in your connectors, Microsoft 365, so that no hacker is going to use a random IP from Russia and spoof your domain. And the second one is advanced filtering. So this is really important. Make sure you open your attachments in Sandbox. As early in career, I try to open my whatever attachments or email I see directly in my host system, thinking that nothing is going to happen. I'm going to be fine. Don't do it. I got into trouble, so do not do it. Make sure you got good Sandbox in your email. And the third one is vendor risk control. Validate sender infrastructure, not just domain. Whenever you, I've told this like 3-4 times right now. So whenever you sign contract, you have to review their security posture. That is really important. And fourth one is user awareness training. Make sure you use really good simulation tool out there. How many people do here like phishing awareness at least once a month in your healthcare? Oh yeah, nice. I see a lot of people doing it. So make sure you do it and have an incident response playbook. Make sure people know what they're doing. If you have a small team, this helped me a lot. And the path forward. So where is healthcare going? What's the path forward in next 5-10 years? The first one is going to be AI versus AI. It's going to be a hacker using ChatGPT to draft a nice email, and we use AI to prevent those emails. So you guys see there's nice vendors out there, right? Darktrace, Mimecast, all those guys use AI to, prevent phishing emails. So it's going to be AI versus AI. It is going to be a little hard, but with proper, security implementation, it's going to be easy. So, and the second one is behavior-based detection. A lot of people, how many people here, do an integration with your SIM? How many people push email logs to their SIM? Oh, yeah, nice, yeah. So this is really important because it's going to give you a lot of visibility towards your email. We got nice SIMs out there, CrowdStrike, Rapid7, Sentinel-1. Everything is great. You're going to see your endpoints, servers, firewalls. It's amazing, but you're going to see your email too, because email is also important. The reason I'm trying to push this again and again, I've seen people just, thinking that email is not important. They spend a lot of money on other stuff. They don't spend money on email. The reason is they just think email is going to be fine. We got email gateway. We got strict policies in email. Nope, it doesn't work like that. And the third one is cloud native defenses. We are still on-prem. A lot of healthcare, they are still on-prem. Cloud is booming, and cloud has already boomed, AWS, Azure. But still, a lot of people are still on-prem, and slowly they are moving to cloud. So when you migrate that process, this is old topic, guys, but still, it's still happening. When you migrate, make sure you migrate safely, because things are a little different in cloud than on-prem. That is important too. And the fourth one, I'm pushing this again, collaboration security. Things doesn't only happen in email. It's going to happen in your Teams. It's going to happen in your Slack. With malicious links, fake invites. This has been going crazy. I get a lot of fake invites, in my calendar. You're just going to delete it. Make sure you do not just go ahead and accept and whatever. Just don't listen to the bad guys. So key takeaways. I'm going to give back the time today. I know I got time up to 10:45, but I'm going to give you guys some time for questions. So the first one is email is the #1 entry. So 70% ransomware originates here. And second one is compliance is not security. Compliance is great, but if you meet compliance, you don't meet security. So misconfig and human error still happens. The third one is protecting email is protecting patients. Have that, the trust towards everything. Trust is really important in healthcare. When you break trust, you lose a lot of things. And thank you, guys. Thanks for coming to my talk today. I know it was pretty quick. This is my LinkedIn. And if you guys have any questions, I'm happy to answer. And thank you. Any
Does
questions?
anyone have any questions? Anyone? Bueller?
No, she's running.
All right. Thank you so much.
Thank
We
you, guys.
appreciate
Thank
you.
you. Thank you.